Andrea and Andrea will all be joining by Zoom today for various weather and school and childcare related reasons this morning.
Yeah.
So
there's no end to, reasons why people can't be where they need to be right now.
I know, it's
Challenging.
very challenging. So I'll sit here to help facilitate the
we
sound
should
and
have a whole
connection and
selection of
everything.
just
And
choose
that's the
which one you'd
only
like to
agenda
use today,
change
or this
today,
time of
too,
day.
is that Andrea
Yeah.
Crofty will be
Because
here to be welcomed as well.
every one of them
Initially,
is
she wasn't
valid.
going to be able to
Yep.
make it.
Yeah, I was cruising in this morning, and I'm like, from driving in the inclement weather with the ambulance and everything else, I'm like, this isn't so bad. I'm cruising along, and then the wind picked up, and it was going, and it's like, that's a little hard to see. And then it seemed like the wind had died down, but there was still all of this, going on in front of me, and I was like, oh. I just got on the brakes. There was somebody going like 30 miles an hour in front of me, and I was like, oh boy.
my gosh. Yeah.
Just at that time of day where you couldn't really tell, whether it was
Mm-hmm.
wind or whether it was a vehicle in front of you.
Yeah.
James, good morning.
Good morning.
Good morning. It was so nice of Mike to get these.
Mm-hmm.
That's great.
Yeah.
I was telling April I'm down to 3 of these, so.
Did you get yours online?
I did.
Okay.
Long time ago, I got like
Oh.
a box of 500.
Oh, my goodness.
Well, it was for the family and.
Yeah.
So,
Well,
yeah, when I did that and was loading up on disinfectant wipes and, all those things that, but the supply dwindles. But now I actually have had those remaining 3 by my front door, so if I have somebody come who doesn't have a mask, I can hand them one that's wrapped and
yeah.
it's available. So
Yeah.
that's a nice piece.
And they say to you, thank you very much.
Actually, everybody I've asked has been really polite. I've only had to ask 2 people in almost 2 years. And they've been very polite, so.
I had to go to Duluth for an eye appointment yesterday, and I heard people arguing about the mask thing all over town.
Really? Yeah.
I have to do that?
Well, I have seen a change just here in town, like yesterday. I saw a change because last week, we still saw a lot of people without masks, and yesterday it was different. I mean, I think this most recent number that came out has gotten people's attention.
Well, when
Not
it's
all,
20%
not all,
of-
But,
Yeah.
but,
What's happened,
it
yeah.
got people's attention that they were like, holy smokes, this is serious.
Hopefully, yes.
Yep.
Alison, is the technology working?
Yeah, it's just taking me a few minutes to get everything connected and the agenda pulled up.
David, good morning.
Good morning.
Have I been promoted
Yes,
or demoted?
with all,
Promoted.
with all obligations
Not sure
thereof.
which.
Oh, Stacey, would you like this for your rowdy meeting?
Fine, they had been plowing right before I got on, so that
I don't
was
think
good.
we-
I don't think I'm gonna be
wasn't.
here long. I was going that way, so.
Should
You know, you
knock
just
on
take
my
it
head,
easy
it'll make
and-
us a hollow sound.
And I have good tires and I can drive the winter.
Yeah, yeah.
I don't drive ice, but I can do this.
Oh, yeah, I can drive in snow, that's fine.
Yeah.
When you get those ice storms.
Yeah.
You just,
Oh, I used to hate visiting. I love visiting my dad in Iowa, but I hated the drive.
exactly.
Oh, it was always icy.
Yeah.
Yeah, if it was icy, I'd be driving my wife's Subaru, that just does a whole lot better. My pickup truck on ice, all it takes is a little wind, next
Yep.
thing you know, you're just,
Oh,
you
yeah.
Yeah.
know,
Yeah.
you're all over the place.
Good
We had a
morning,
van for a
Rena,
while and
Grace.
got rid of
Oh,
it
yeah.
because
Andrea
it
and
blew
Andrea.
all over. It was just,
Hi, good morning.
Yeah, I had one of those too, and I even had it with all-wheel drive, and I thought, wow, this is the best thing ever, but again, all
Good morning.
ice with wind.
Thank you for doing this.
Absolutely. switch this screen. Well, that's not real helpful, is it?
It's okay, Alison. I can just imagine.
Thanks, guys.
She doesn't have young kids.
Sorry?
She doesn't have young kids. I can just imagine.
Just imagine it.
All right. we got everything. Good.
I'll probably just move back and forth as we need to switch gears, if that's all right.
Yeah.
Whatever it takes.
Are we ready?
Are we live?
I think we're set.
Let me message Sarah to make sure we're live.
Okay.
Oh, we have sound in our streaming. There we go.
Okay. All right. Good morning, everyone. I'm going to call the Public Health and Human Services Board Tuesday, January 18th, 2022 to order. We have an agenda in front of us. Are there any additions or changes to the agenda that anybody would like to make?
Madam Chair, I'd like to make a motion to approve the agenda.
Thank you, Commissioner Mills.
I support.
We have a motion and support. Any discussion? None? All those in favor?
Aye.
Opposed? Motion passes. Here comes Beth. All right, that approved our consent agenda and our meeting agenda. We are going to move on to the election of the 2022 board chairs. I'm sorry. So, do we have any nominations for board chair?
Madam Chair, I first just want to thank you for your service as chair. I think it's important for everyone to get that experience, and I think you've done a great job leading us through yet another difficult year of the pandemic, and this one is probably more strange and confusing than earlier on. So I just want to,
Thank you.
offer my appreciation and would also like to know if you had interest in serving a second year as chair.
Well, thank you for asking the question. I do not that I wouldn't be willing, but I do see the value of changing and making sure that we all have the opportunity. And I have learned a lot as board chair, and I would like to share that experience with others. So I would ask if there's anybody that would like to be board chair or not be board chair, I guess, before we ask for nominations. Anybody say, absolutely not, I don't want to be there. It's not so bad. Okay. Commissioner Storley has indicated she's been in this role before, and we thank her for her previous service. So I will open up the nominations for board chair.
Madam Chair,
Commissioner.
I would like to nominate Commissioner Mills.
Thank you.
Are there any other nominations?
I guess I would, Madam Chair, if I may, I'd like
Yes.
to nominate Commissioner Svaleson.
Commissioner Svaleson, are you open to accepting that nomination? All right, so we have two nominations. I will ask for the third time, are there any other nominations? If not, hearing none, seeing none, we have two nominations for board chair. I discussed with Alison McIntyre about how this works, because at our regular board meetings, we do it by ballot. And traditionally, I guess, this board has not done it by ballot. I'm not exactly sure how we will do it with some people attending by Zoom. So I guess.
But they put it in the chat, Madam Chair?
Should we do it that way? Do we want to vote by ballot or voice?
Voice is fine.
I'm also comfortable with voice. And could we have some discussion before we vote?
Yes.
Okay.
Good.
Yes, I think we should. Would you like to start, Commissioner Mills?
Yes, thank you for your nomination. I'd be honored to serve as chair. I had just served as chair of regular board meetings, and so I feel like I've got some of that experience under my belt, but I also, not knowing the future, would like to share the experience with others who have not yet served as chair. And so that's why I wanted to nominate Commissioner Svaleson, but as I said, I'm very willing and would be honored to serve as well. So,
Commissioner Mills, I just wanted to let you know I nominated you because I know of your strong interest and passion in this area, and I feel like you have a broad range of knowledge and would be very helpful in leading this group and teaching this group, just as you did in serving as board chair for our county board. So I just wanted to share that rationale with everyone.
thank you.
I agree with Commissioner Sullivan. Strongly agree with Commissioner Sullivan.
I guess that leads me to wonder about how, because I kind of thought we should maybe share it and give you some experience also. So I was kind of, not that I don't think you're
I'm feeling really well
great.
experienced right now.
So this is difficult.
Well, Madam Chair, and I didn't mean to make it difficult. I just wanted some conversation and.
No, it's fine.
And, you know, on further thought and consideration, we are still in a pandemic. And so, just with my various public health, connections and involvements, with other regional boards, I would be very happy to serve as chair and to, keep pushing ahead.
Thank you. So are there any other discussion before we?
Let's make it official.
All right, I will call the vote, and since Commissioner Mills was nominated first, I will start with that. All those in favor of Commissioner Mills being the board chair for 2022 signify by saying aye.
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 Congratulations.
Do we need,
You can tally the others.
Oh, yes, we need to ask.
You can ask Rana to affirm that. If Rana, you'd like to unmute.
Yes, I affirm.
Okay, great.
Thank you.
And then Pat is our interim appointed chair of the PHHS Advisory Council. That was on your consent agenda. Bev will take that role when she reaches 1 year of service on the council in March, but we'd ask Pat to affirm that as well.
I say yes.
Do you want to join us at the table now that it's official, I guess? I should have invited you after we passed the agenda.
I don't care. I'm fine.
I'm thinking because of the microphone, it might be helpful.
Yeah,
Okay.
yeah.
Thank you, Pat.
There.
There you go.
Wherever you would like to sit.
I don't care. How do you want it? Here? Good?
Well, it's,
Ideally,
Roger was over there.
Ideally, yeah.
Ideally, let's do ideally.
Then you'll be on camera.
All right. You want me over there? You care?
No, you're fine right here.
And thank you for your willingness to serve as interim.
Well, this is a great
Much.
board. I'm very excited to be a part of it, and I have been for a number of years.
Thank you. All right, well, thank you, colleagues, for your confidence in me as chair, and then we'll move on to the election of our PHHS Board Vice Chair. Who was the Vice Chair this last year?
Commissioner Sullivan.
Okay, yeah, well, we never had any absence from our chair, so there was It was
There
behind,
was
behind
one
the scenes.
opportunity that I said,
Yep.
be on guard.
Right.
Yeah.
It worked out.
Yeah. Well, so does anyone absolutely not want to serve as vice chair? Very good. Oh, I'm sorry, I saw a
Sorry.
movement here.
Yeah, I take a little while to think. Yes, that would be me.
Okay, so Commissioner Hawkins, you would not want to be vice chair?
Correct.
Okay, thank you. Then I'll open it up for nominations for our PHHS Board Vice Chair. Commissioner Sullivan.
Mr. Chair, I'd like to nominate Commissioner Svaleson.
Thank you, Commissioner Sullivan. And Commissioner Svaleson, are you willing to serve as
I
vice
am.
chair? Okay. Are there any other nominations for vice chair? Are there any other nominations for vice chair? Are there any other nominations for vice chair? Hearing none, I'll close the nominations, and we can go ahead and vote on it to make it official. We have one nomination for Commissioner Svaleson to be vice chair of the PHHS Board. All those in favor, please raise your hand and say aye. Aye. Opposed, same sign. Motion, or nomination, election passed unanimously. How's that? Very good. All right. We're on to item 4, the introduction of new staff. Alison, I'll hand it over to you if I may, and we'll do-si-do with the mics.
Okay, well, joining us on Zoom today, I'm very happy to introduce and welcome to the PHHS team, a few months late, Andrea Orest as a public health educator with our public health team, and Andrea Tofty also joining us in a permanent full-time position now after Jody Turbo-Roberts resigned late last year. So really thrilled to have both Andrea and Andrea on board. And I'll hand it to Grace if there's anything else you want to say to introduce these two, or if you all would like to introduce yourselves as well.
Sure, I'll just echo what you said. First of all, can everyone hear me well?
Yes.
I'm on Zoom.
Yep.
Very well.
Yes? Okay. Sounds good. Yeah, I'll echo what Alison said. I'm thrilled to welcome both Andrea and Andrea onto the public health team within PHHS. They're both fantastic additions to public health team and have already done great work in helping us with the COVID response. So really glad to have them both here, and happy to have them introduce themselves as well. So Andrea, let's start with you. If you want to just give your name and say a few words about why you're excited to join the team.
Good morning. My name is Andrea Tofty, as I was presented. I live on the West End. In Tofty, I joined public health as a temporary part-time worker last year. So I have already worked with the team and understand the scenario that we're facing in Cook County for the pandemic. And I have been working along Grace and Alison to find good mitigation strategies and find ways to support the community at max. And I'm very excited to be part of the team as a part-time permanent employee, and eager to find the best ways and to contribute in the response, and also to acknowledge public health matters that are so important for our community. Thank you.
Thank you.
Thank you.
You, Andrea. All right, Andrea.
Hey everyone.
Off as well.
Yep, thanks. I'm Andrea Orest. My kid's gonna talk now. It's quiet the whole time Andrea was talking. I'm Andrea Orest. I used to work in the SHIP role, so I have been partnering with public health throughout the the entirety of the pandemic. And I was excited to take on this new role to learn new things and contribute more to the pandemic, and then also to focus on public health issues that are beyond the pandemic slowly as we work through the pandemic, but excited to do more post-pandemic, whatever that looks like.
Thank you.
Thank you.
Thank you. Yeah, I think we're still very, very much focusing our efforts almost entirely on the COVID response, but I think it will be exciting to move forward into the recovery phase at some point and start to add in other areas of public health responsibility at some point in the future. So really glad to have both Andrea and Andrea on board for whatever comes our way next.
Thank you, Grace. And thank you, Andrea and Andrea, for your willingness to join the team and your efforts through the pandemic thus far already. So very, very pleased to have you aboard. Any questions from members of the board here for our new staff? All right, well then we can move into item 5, the COVID-19 situational update. And Grace, we've got you on the big screen still, and I'll just hand it over to you.
Sure, and it has been quite a busy month for the COVID response. I actually have put together a PowerPoint for today just because I think it'll give me the opportunity to use some visuals, which will be helpful to talk things over and kind of to talk over where we're at with the pandemic right now. So I'm gonna pull that up.
Okay.
All right, so getting into just the situation as things stand right now. So our case count as of last night was at 607. So for a point of reference, when I last presented to this board on December 20th, it was at 367. And when I look back 2 months, we were at 303 on the meeting on November 15th. So in the last 2 months, we've basically doubled the number of cases that we saw in the entire rest of the pandemic combined. So things have really accelerated. And that is something that I attribute largely to the emergence of this new Omicron variant. Based on what I'm seeing regionally, Omicron is the dominant variant. It is still circulating alongside the Delta variant, but I think it's safe to say that this is now the most common strain of COVID-19 spreading throughout Cook County. A few other points to note: our vaccination rate continues to trend upward, which is fantastic. We have 80.8% of Cook County residents fully vaccinated, and I continue to see anywhere between 10 and 15 new fully vaccinated individuals per week. When we do that weekly update to the hub, it's a good chance for us to see how many newly fully vaccinated individuals show up on our count. So that's where we're at for vaccination. I will note that as our case count rises, there's a discrepancy between what the State Department of Health is reporting and what we're reporting. And that is because we are trying to have people call in their over-the-counter positive results so that we have the opportunity to talk them through recommendations for isolation. So for what this looks like is just this past week when I did the count, about half of our positives were from over-the-counter tests. And that wasn't the case at all 2 months ago. They were all going through the lab system or the mail-in saliva test system. So that's a huge change, and that is why our case count appears so much higher when you look at our county numbers versus what you look at what the state's reporting. staffing, we did talk through and welcome Andrea and Andrea. We also, in the consent agenda, talked over adding part-time temporary staff to backfill some of the time that we need to dedicate to the response, with Andrea transitioning from that part-time temporary role into the full-time role with public health. So Andrea will continue to focus on testing with the schools, and some of the part-time temporary staffing that's going to backfill that position will be focusing on helping us update materials and help us respond to the increased volume of cases coming in terms of phone calls to positive cases. This past month has felt very different from previous months because our case volume has been so high. The Omicron variant itself behaves differently than previous variants. It's about 3 times as contagious. So whereas before we were seeing, vaccination and other mitigation strategies really kind of keeping things at bay, the Omicron variant has challenged the way we see transmission happening. So, for example, when someone tests positive in a household, it's now very common for other members of that household to test positive because this variant is so contagious. Whereas in the past, we weren't seeing, in restaurants and public spaces in the community, widespread transmission. At this point, I think that is no longer the case. I do think that there are situations where people are out about in the community and might be exposed to the virus in a large enough dose to register positive. We're seeing more transmission in schools and youth programs, as well as childcare, and that is having a huge impact on the community at large. It's rippling out in the form of quarantines and now the school district's decision to move to distance learning. Basically, as a large number of people have all gotten ill at the same time, it's also impacted workforce as more and more people are just out sick. And, we already had a situation where we didn't have a lot of depth in terms of staffing in a number of our businesses and agencies in the community. So to have a large number of people falling ill at the same time has really stressed workforce issues as well. So it's been quite a month. So I talked a little bit about Omicron, and I've mentioned this in the past board meetings as well. Omicron is what we call in public health a variant of concern. And when we talk about variants of concern, there's 3 things we're looking at. Transmissibility, in other words, how easily it passes from one person to another. Omicron is very definitely more easily passing from one person to another. Virulence, in other words, how ill it makes people. And immune evasion, in other words, whether it compromises how well vaccines and other medications and treatments are working. For virulence, it does seem to be more mild in that it's not sending as many people to the hospital, but it's unclear how much of that is because we have a population that's more highly vaccinated and how much of that is just the nature of this variant itself. And in terms of immune evasion, it is affecting our vaccines and drugs, but it's not rendering them useless, and I'll talk more about that. The vaccines are still doing a really good job at keeping people from landing in the hospital, having severe disease, or dying due to COVID. However, the evasion piece means that even people who are fully vaccinated or have had COVID before are more able to become infected with this new variant. And we'll talk a little bit more about that in a second here. Just to put in context the numbers we're seeing locally with the numbers we're seeing statewide, this is a graph of the daily case trends throughout the state of Minnesota throughout the whole pandemic. So you can see here in the beginning, we had very few cases. Right here around, late May, June 2020, that's when we saw our first cases in Cook County. We saw a big spike around Thanksgiving in 2020. That maps onto what we saw here in Cook County. And then things kind of started to calm down. This right in early 2021, that's when we were doing the bulk of our vaccinating here in Cook County. Over the summer, things were really quiet. And then as we went into fall, Delta started really taking off, and you can see those case numbers rise and rise. And then as you get into December, they just shoot basically off the charts, and that's Omicron. So that's what we're seeing in Minnesota overall, and that maps pretty well onto what we're seeing here in Cook County. So I talked a little bit about immune evasion. So yes, people who are vaccinated are able to become ill with COVID, and they're able to pass the infection on to others. That's the same for people who've had COVID before and have recovered. They can become ill with COVID again and pass that on to others. I think where you really see the strengths of the vaccine and the fact that even though this new variant very, very strongly against those serious outcomes, which is what we really want to see with any vaccine. So more graphs. Sorry, but I feel like it's actually really helpful to see it visually. I really like to have visuals along with explanations. So in the upper left, you see from basically the point at which we vaccinated the bulk of the population through to now what's happening with cases in Minnesota. So this green line is people who are fully vaccinated. Very few cases through the summer months. In the fall, you start to see more cases among people who are vaccinated, but it's still significantly lower than the population of people who are not fully vaccinated. Again, this dip kind of represents the summer when things were really quiet, and then it picks up, and with Delta, we see just a skyrocketing of cases concentrated overwhelmingly in the population that's not fully vaccinated. And then it takes off even more with Omicron, which is starting kind of in that mid-September, which is when these graphs end. So cases, infections, that is one thing that we look at, but we also really want to pay close attention to severe outcomes. The primary goal of the vaccines is to prevent people from getting severely ill, landing in the hospital, or dying due to COVID. And those graphs remain very steady. That green line of people who are fully vaccinated barely moves at all. So the ability of the vaccines to protect the population from landing in the hospital and passing away due to COVID is largely maintained, even with this new variant. However, when you see, again, moving into the fall, moving into when we started to see Delta, you see the rates of hospitalization and death among people who are not fully vaccinated really start to climb as we see more case activity. So when we say Delta, or when we say Omicron is more mild, it's really not, that's not what we see in terms of vaccinated versus unvaccinated. We still see those serious outcomes being largely concentrated in people who are not fully vaccinated. So, take-home message, the vaccines are continuing to provide excellent protection against severe disease, hospitalization, and death, even with Omicron becoming the most common variant. There is some what we call immune evasion with Omicron, and that leads to more cases of COVID in people who are fully vaccinated. Really what you see with the vaccine is it teaches your body to recognize the spike protein on COVID-19 so that it can recognize it quickly if it comes into contact with the virus and fight off the virus from copying itself in your body. With Omicron, the spike protein looks a little bit different, so it takes more time for your body to recognize what it is and start fighting back. The booster doses with Omicron are really important. When we look at outcomes for people who are boosted, specifically, they tend to have less intense symptoms. They're sick for a shorter period of time. They're less likely to be hospitalized, spread the disease to others, even within the same household. And it also counteracts that idea of waning immunity. In other words, the immunity getting weaker over time. So the boosters with Omicron are really important. One thing that I've heard, and I really want to stress that this is not a good idea from a public health perspective, is that if everyone's going to get COVID, if everyone's going to at some point get COVID, why not just get it now and get it over with? And I think at this point that would be a very dangerous strategy to take. For one, we don't understand what your long-term immune response will be. Will you continue to be immune after you get COVID? We're not sure. The data is just not there. Anytime a person becomes ill with COVID, there's a risk of having long COVID symptoms, and that's, again, something we don't understand very well and could potentially lead to long-term complications for your health. Whenever you get sick, there is that chance that you'll have a more severe case. So that story that this is milder really is not a sure thing for anyone when they get sick. I think it's especially if the person is not yet vaccinated. There's a chance of spreading the virus to other people who might not fare well. And at this point, our healthcare system is really overwhelmed. And again, going along with that variable immune response, I think it's important to note that you're not just getting COVID and being done with COVID. We do see people getting reinfected and getting COVID multiple times. So at this stage, I'd much rather see people coming in for vaccination, coming in for their boosters, and not pursuing the strategy of just getting COVID-19 to get it over with, since it seems like so many people are falling ill at this point. This is my favorite analogy. It talks about why boosting is important. So every time your immune system, your body is exposed to an antigen, that's the part of the virus that really makes your body sick. Every time it sees it, it gets better at recognizing it and attacking it. So when you get a vaccine, it teaches your body to recognize that antigen, the part of the virus that'll make you sick. So it gets better able to recognize it and respond with each booster dose. That's why the booster is important, because Omicron looks different. And so if your body encounters that vaccine multiple times, you don't have the same risk of getting sick, and you're teaching your body to recognize the spike protein on the virus, even if it looks a little bit different. So your body gets smarter, your body gets better able to respond without all of the negative side effects that would come with being exposed to that antigen, that spike protein, through actually getting sick with COVID. So this is the analogy, and again, I like the pictures. I think the picture is worth kind of helping you understand what's going on here. So say you meet Alex at a party and they have blonde, medium length hair, and then you meet them again a month later and it takes you a while to recognize them because they've cut their hair, they've dyed their hair, they kind of look like a different person. If you become friends with this person, Alex, it'll be easier to recognize them because you've spent a lot of time with them. And this time, if they dye their hair or cut their hair, you'll know who they are because you have more of a relationship with them. Even if they change the way they look, you'll still recognize them. This is kind of how our immune system works with the vaccines. That's why the booster dose is important. It's another chance to see that spike protein and to be able to recognize it, even if it has changes due to the mutations, like what we're seeing with Omicron on that spike protein. I already went over this a little bit. I guess I forgot to delete it from earlier on. So I think right now, with so many people getting sick, it's a good time to revisit what is called the Swiss cheese model of virus defense. In other words, I also call it the layered mitigation strategy. Again, I love the picture. So you think of Swiss cheese, every single slice has a few holes. It has a few places where the virus could get through. But if you line up multiple pieces, those holes kind of plug each other up. And in the end, you're less likely to have the virus get through. Especially with what we're seeing with people who are vaccinated, able to get COVID, pass COVID to others. I think this is a time where everyone really needs to revisit this. Things that we know work to prevent the spread of COVID still work, even if Omicron is more contagious and we see more people getting sick. distancing, having good ventilation, wearing a high quality mask, washing your hands, testing when you feel sick, staying home when you feel sick, talking to us about how long to stay home, and if you're exposed, what to do as a person who was exposed. All of these things put together help limit the spread of COVID. So I know it feels like this is a lot, there's a lot going on with COVID, but I think it's important to remember that we have so many tools, so many more tools than we had in 2020 to deal with this. We just have to use them. And the more people who use them and the more frequently they use them, the better off we're going to be. This isn't going to last forever, but I think the next month, month and a half are going to be a challenge. Additionally, other things that have happened this past month, the CDC changed their guidelines for isolation and quarantine. That was the week of Christmas. The Minnesota Department of Health adopted these changes last Wednesday, and we started to use them last Wednesday. They're quite different. So in a nutshell, they changed the definition of what it means to be fully vaccinated. So if you're booster eligible but not boosted, you're no longer considered fully vaccinated. Again, that booster is really important with Omicron being more contagious. That's part of it. They shortened the isolation down to 5 days as long as you have no symptoms and you haven't had a fever for a day. And they add a 5-day period at the end of isolation and of quarantine where you're being very careful. You're wearing a mask anytime you're in public. You're not going to visit people who are at higher risk for complications due to COVID. You're not going places where you can't wear a mask for those 5 days following a quarantine or isolation. So that's a lot to adjust to. It's a lot to try to make the community aware of. So we're pivoting as fast as we can and working with partners in the community who might have questions or wonder how they can operationalize these new guidelines for their facilities. Specifically, we're working quite a bit with childcare and school right now. The over-the-counter rapid tests have also become much more available in the last month here. And so whereas before we got most of our positive results through the local lab, we're now having people call in their positive results. And again, that's about half of all the positives we're seeing. The case volume has just gone through the roof, and that's been a huge adjustment as well. We're still calling people, talking them through isolation, quarantine recommendations, and in situations where we just can't call everyone in a timely manner, we're really focusing in on the school-age population, healthcare workers, and school and childcare staff. I think it's going to be really helpful to revisit and revise our guidance so we're able to give that out to people at the point of testing. And so even if they don't get a call right away, they know that they can reference kind of a handout that we give. But that's been we have been able to keep up with the case volume, but it's been a challenge. And thank you to Andrea Orest for really doing the bulk of those calls in the last 2 weeks here. It's been amazing to just see you really dedicate yourself to taking those calls and making them. So a lot goes along with these new guidelines. It's a pretty significant pivot for us in the county. Testing, this is something that Andrea put together. She had her first week of routine testing with the schools last week. We did, and was going to be doing testing today with the schools as well, but with the snow, they've canceled school today. So that's why Andrea is able to be with us. But this is the results of the first day of our testing pilot, the first 2 days last week. So there were 38 people tested at ISD 166 last Monday, and then 19 people tested at the community center last Wednesday. And we were able to identify 3 positives over the course of those 2 days. And again, the people who we're identifying are largely people who are asymptomatic. And so even though they test positive, they're not showing signs of illness, but they are still able to pass the virus on to others. So that's one of the big challenges with COVID overall, and why doing a program like this is so impactful, because it can catch those people who would not have otherwise necessarily stayed home because they were feeling fine. So I think it's a really great step forward to trying to support our schools through the rest of the school year. I mentioned the rapid tests becoming more available. Both the clinic and the hospital now have them. And that's a change from last month. That's something that's new basically since around the last week in December. And we still continue to have the drive-up testing available through the clinic and hospital. I think adding the school pilot and the over-the-counter tests has really maintained our ability to do those drive-up tests and accommodate the overall growth in demand for testing. One more, so vaccination, we're still doing vaccination once a week. We did twice a week last week, adding a Saturday option so that could increase availability for people. This is really, I think, one of our number one priorities between Sawtooth Mountain Clinic and public health to maintain that availability of weekly vaccination opportunities. It's been a challenge, I would say, in the past 2 weeks because, like the rest of the community, I think across the clinic and public health, we've seen people impacted by isolation and quarantine, whether it's, because of kids being out of school or childcare or people falling ill. It's just been, it's been a challenge, but I think we've done a fantastic job at continuing to have those weekly opportunities available, and then also accommodating the community members who may be impacted by quarantine or isolation themselves, either for their children, their family members, or they themselves are feeling ill. So we've tried to really find a balance here and continue to make this something that's available on a weekly basis to community members, and that's going to continue into the future, into February. So I think we will in February. We're planning to move into the social room at the community center and have smaller events, but continue to offer them on a weekly basis. So this is a more detailed look at the rundown of vaccination rates, both by the kind of raw number of individuals in each age category and the percentage in each age category. So as it has been almost the entire time, our 65 plus population is the most highly vaccinated group in the county. Oops. And it sort of goes down by age from there, but we are seeing those rates just trickle up bit by bit from 1 week to the next, which is really great to see. Because again, the vaccines are continuing to do a fantastic job at preventing severe outcomes in our community. And then community engagement. At this point, a lot of it is engagement around updated CDC guidelines, trying to do more messaging on the breakthrough situation and kind of how to help people make sense of that. It's just really important to let people know that it is disappointing to test positive for COVID after being vaccinated, but it doesn't mean that your vaccine isn't offering you any benefits. It absolutely is. And so I want to make sure that message is really clear. There's also a demand for more like KN95 and 95 quality masks, and that's a hard thing in the community right now. I think quite a few sources are back ordered online. I did order 5,000 through MDH, and they haven't arrived yet, but once they do arrive, I would like to make those more widely available to people in the community. I know there's very few, if any, places that people are able to purchase those locally, so that's something that's on my radar as well. A lot of information. It was a really busy month for COVID, but I thought it was important to kind of give that update and let you know what I think has been happening and give you all a chance to ask questions as well.
Thank you, Grace. Yeah, very, very busy. And those infographics, I think, were very, very helpful. So thank you for putting those together, especially those line graphs, I thought, of the vaccinated, unvaccinated, just to try to help better understand what's going on, because I know of many people who are fully vaccinated and got significantly ill, out for 2 weeks situation, and stopped eating and that kind of stuff. So it's just like, just seems like it's everywhere and everyone's getting it. But having those graphics, I think, really helped better understand, for me at least.
Thanks, Commissioner Mills. I think also sometimes when we talk about severe, severe essentially means you need assistance breathing and you land in the hospital. From a public health perspective, that's the definition of severe. But from a personal perspective, you can feel quite ill and not reach that level of severity. So I think there's sort of a disconnect in how we're defining a severe case, because no one wants to be out sick for a week or two. That's not a fun experience. That is severe under a certain definition. It's just not the definition that's not how we usually define it in public health, I guess.
Yeah, that makes sense. And I think that's probably part of the reason why there's so much confusion, just with what's out in the media nationally talking about Omicron seems less severe. Well, yes, by the public health definition, it may very well be, but people are still getting very sick and having to be out. So, questions from the board? Commissioner Svaleson.
Well, again, not a question, but comment. Thank you for your leadership on this, Grace, and thank you for the visuals, because I also am a visual type of person to bring it in. And I think it would help the community to be able to see some of those, particularly the ones that are showing the hospitalization and the death for the vaccinated versus unvaccinated. Because I have heard some comments, both in press and locally, where people are looking at it and just saying, well, gosh, we're all going to get it. Let's just get it and be done with it. And that's not a strategy anyone should follow. And the other point as well is the things that we've always been talking about along the way, your reinforcement of those are still the things that will keep you well. The social distancing, wearing a quality mask, those mask qualities have changed, and that's, to be understood, and trying to get those masks, that's a great thing to do, and anything we can do to support, we need to try to help you with that. But no, thank you for your leadership, thank you for what you're doing, and I know the extra time to put together the slides was, with everything else you have on your plate, is very difficult, but it was well worthwhile. Thank you so much.
Thank you, Commissioner Svaleson.
Commissioner Stoyle.
Thank you, Chairman. Grace, a great report. Visuals are wonderful. Will this be posted on our website, the county website, for the public to see?
We can certainly make that happen. We
I
can
think,
share
yeah.
the report with you all, posted on social media and to our county website.
Sure, absolutely.
Great. Thank you.
Commissioner Sullivan.
That's exactly what I was going to ask for, so thank you very much. Yeah, I think the more we can share this, the better.
Yep.
Grace, could you speak a little bit more about that lag time on those line graphs? It's at the very end of the time period. You don't have to pull it up, but I was just wondering, I guess what that said to me is maybe the accuracy in that, or it's not fully compiled yet.
I wish it went a little bit longer, but I think it does. There does wind up being a lag time, and I think it's just due to the reporting. So for cases, the lag time isn't quite as much, but anytime someone tests, it needs to get. For another thing, I think to notice about the cases specifically, I think the over-the-counter antigen is really going to change how accurate those counts are. But for cases, there needs to be enough time for it to enter into the state's reporting system and for the state to then kind of spit it back out in the form of that graph. So there's a little bit of a lag there. The lag for hospitalization and death, I think, is greater because, typically when some people who test positive, they do need hospital level care immediately, but it can be a week to 10 days for even the majority of people who land in the hospital with COVID. So that's always delayed. And then there's the same issue of after it's reported by the hospital as a case into the state system, it takes some time for the state to then put it into its databases and shoot it back out as a graph. So there's always a bit of a lag time. It seems to be about 2 to 3 weeks for the state. So I think, they do update those graphs on a weekly basis. And you can go to their website and actually just kind of look over time a little bit more closely. You can kind of zoom in and see how the trends change week to week, but they change it once a week. So it's always about 2 to 3 weeks behind. And similar to death, similar to hospitalization, there's kind of a natural lag built in because it takes some time for the disease to progress to a point where you would be hospitalized and die. So there's always that kind of natural lag, and then there's the data reporting lag as well.
Thank you. Any other questions for Grace this morning or comments? All right. Well, thank you very much, Grace. And it's very staggering looking at the numbers. And I know everyone is doing what they can, and everyone is overwhelmed. I really just appreciate your level-headedness and presenting data as best we can, and continuing the fight. So hopefully our community can pull together again here and slow things down, but the transmissibility sure is a difficult thing to work against. So.
Absolutely. Well, thank you. I'm sorry I'm not able to be there and see you all today, but thank you for being here and for taking the time to listen to the presentation. I'm always happy to share information with you.
Thank you, Grace. Be well.
Thank you, Grace.
Okay, dokie. We'll move on now to item 6 on our agenda, the staff report. I'll hand it over to Alison.
All right. I'll ask for you to bear with me for a bit of an awkward technology transfer here as I switch from Grace's presentation to mine. Plug this in here. All right. So this morning I have a year in review of the PHHS department for 2021. The PHHS department includes 6 primary areas of direct service and support. I'm not sure why it's captioning me. I'll try and turn that off. There we go. Okay.
But it's interesting.
Good to know we have that option. Yeah. So the 6 primary areas of the PHHS department are human services. That includes the adult and home and community-based services unit, who primarily serve residents who are elderly or have a disability, and the children and family services unit, who serve people and families managing and recovering from mental illness, substance use disorders, or needing other supports to maintain stability and safety. Our economic assistance and healthcare programs team administers federal, state, and local programs that help residents meet their basic needs and access healthcare services. Our public health team, who you met this morning, provide community health promotion, infectious disease prevention, and public health emergency preparedness and response work. We have administrative staff that work across all program areas, providing customer service, coordination, contract and grant management. Our fiscal staff perform mandated grant reporting duties, receipt of state and federal funds into accounting systems, estate recovery, and billing for services that are provided by our staff and licensed programs. Our department also contracts with service providers in the area of child support, substance use disorder assessment and treatment services, the in-home support program, and a variety of public health programs, primarily through Sawtooth Mountain Clinic and North Shore Health. Our department includes 30 permanent staff and 2 part-time temporary employees in the public health team. In 2021, we had 7 positions turnover due to staff resignations and retirements. In 2021, Katie Smith, Beth Benson, and Anita Josiah all retired. Resignations included Anthony Booth, Matthew Baxley, Kathy Ann Travis, and Jody Turvo Roberts. This was a significant increase in turnover over last year when we had just 1 position turnover in 2020. An average year sees about 3 or 4 positions turnover. We added some new positions in 2021. This included the addition of a second full-time permanent public health educator. We welcomed Andrea Orest in that role in August and are grateful to have the stability of this position. Throughout the pandemic in 2020, we relied on temporary staff to support our response work. And this capacity has been really critical, as you heard this morning, to maintain our high-quality response during the pandemic. An additional staff and service added in 2021 was our substance use disorder and co-occurring disorders case manager. Historically, that work was performed by our 1 adult mental health case manager. Also, during transitions, we had our case aide providing some of that treatment coordination work for both outpatient and residential treatment, and during other transitions by our children and family services supervisor. So adding dedicated support in this role adds very important capacity to people in recovery in Cook County. We welcomed Melissa Becerras in this role also in August of 2021. In 2021, we also created a second children's mental health case management position. That position was reconfigured after Matthew resigned as our community support worker. Again, the children's mental health case management role adds really important depth and backup in an increased area of need. Other new staff that we welcomed in 2021 included Isabella Sheehan and Stacey Schmidt. In addition to our permanent full-time staff, in 2021, we received support from temporary employees who supported our pandemic response in case investigation and contact tracing, support to schools and businesses, and public health education and outreach. Additionally, in 2021, we worked with a Master of Social Work intern who worked with our department on researching healthcare access, transportation needs and barriers, and presenting those findings to local healthcare partners and service agencies. Throughout 2021, our public health response also relied on volunteers through Minnesota Responds. Volunteers provided over 1,000 hours of support to vaccine clinics and also logged time with the community support line, AEOA food distributions, and case investigation and contact tracing. In Minnesota, we operate under a state-supervised, county-administered delivery model for most public health and human services programs, which means that changes that happened at the state and federal level continue to impact our work as a department in 2021. Many of the program waivers that were put into place during the state public health emergency were lifted last year, which changed the workload for staff who provide economic assistance and healthcare programs and staff throughout the department. A significant change in 2021 was the loss of Ascend Services, who was providing community-based mental health services. We, as a department, began integrating some of those services within our Children and Family Services team in 2021. And again, the added staff in children's mental health and substance use and co-occurring disorders were a part of that expansion. We've also included a new FTE for 2022 to provide therapeutic supportive skills services. Again, these were services that were historically provided by HDC and Ascend, and our plan is to bring someone on board this year to do that work and to pursue certification with the Department of Human Services to bill for those services. In 2021, our adult and home and community-based services team went through the lead agency review with DHS. This is the largest audit for this team, the purpose of which is to monitor outcomes and compliance, share innovations and feedback. Our audit this year resulted in just one minor corrective action related to documentation and was a significant improvement over the past audit 4 years ago. The audit team acknowledged the strength of our PHHS team in collaborating with other service providers and developing plans with service recipients that were individualized and strengths-based. DHS also recognized the strong performance of our academic assistance team in meeting performance thresholds for application processing timeliness in 2021. Our team in Cook County was one of just a handful statewide that were able to consistently meet this threshold in 2021. Finally, staff sought out grant funding to support and expand our work in 2021. Staff applied for and received funding from a number of entities, including the Department of Human Services, Minnesota Department of Health, NACO, which is the National Association of County and City Health Officials, the North Shore Healthcare Foundation, and the North Shore Collaborative. These grants supported our public health staff in response work with partner agencies like Grand Portage Health Services and Sawtooth Mountain Clinic, as well as the Growing Families Peer Support Program, among others. So the numbers. Our human services staff within the Economic Assistance Unit worked with approximately 173 households receiving cash or nutrition assistance in 2021. This is up from 167 in 2020. They also worked with 827 households enrolled in medical assistance, Minnesota Care, or a Medicare Savings Program, also known as Minnesota Healthcare Programs, in 2021, and this is up from 608 in 2022. What that means in terms of individuals enrolled, that translates to 1,318 people in Cook County enrolled in a healthcare program. So that's what you see on the graph, just under 20% of our population enrolled in a Minnesota healthcare program. Within social services, across all program areas, there were 429 intakes in 2021. This is down slightly from 447 in 2020. In 2021, the Adult and Home and Community-Based Services Unit, which includes general adult services, adult protection, developmental disability, and waiver case management, provided support to over 272 county residents and their families, and residents who live outside the community but require a higher level of care than is available locally. This is similar to the 2020 total work groups, which was 271. In children and family services, which includes adult and children's mental health, child welfare, parent support outreach, chemical dependency services, and licensing, that team supported over 261 individuals and families in 2021, and this is up from 243 in 2020. Just a note on what that means, a work group. That is a case. It could be an individual, it could be a family. As the name suggests, it often involves many people coordinating and delivering services rather than the one individual. Just as an example, to illustrate, an adult mental health work group might include one primary person who's receiving services, but the work of our staff includes coordination with physicians, treatment facilities, court, probation, other human services staff within the department or in other jurisdictions, and with other staff members. So it's just to provide a bigger picture of what a work group can actually look like in terms of workload. What this all means, you can see there was a notable increase in households enrolled in economic assistance and healthcare programs last year. We can attribute this to a combination of factors, including program waivers that were put in place to maintain eligibility during difficult times, especially for the healthcare programs at a federal level. We also increased our outreach throughout 2021. A part of that was the Minnesota Benefits platform that was made available to streamline that online application process for residents. Across human services, again, we're not seeing a significant change in the number of intakes or work groups, but the numbers are just a snapshot and don't tell the full story of our work, of course. Year 2 of the pandemic, we experienced the ongoing stress of what that means for health, mental health, family, and work stressors. And these are all felt more acutely by the populations we work with who may have less access to resources and have other increased underlying stressors in their families and lives. Public health by the numbers. The EOC closed mid-year in 2021, and state emergency orders were lifted, but the direct response to the COVID-19 pandemic continued to dominate our work in the public health team throughout 2021. In 2021, there were over 250 confirmed positive COVID-19 cases reported, with public health staff working in partnership with Grand Portage Health Services to continue to provide case investigation and contact tracing services for local residents and prevent the spread by providing testing and quarantine guidance. A note on those numbers, that's using the MDH data and looking at their weekly reports. So as you heard from Grace this morning, especially in the new year, we're receiving many more over-the-counter positive tests that aren't logged by MDH. As we entered the new year in 2021, vaccine eligibility was limited to a select group of first responders and healthcare workers. By the year end, over 4,000 residents, or 80% of the population, were vaccinated against COVID-19, thanks to our collaborative work of our public health team with local healthcare providers at Grand Portage Health Services and Sawtooth Mountain Clinic. The total vaccine doses in 2021 were 11,087. And again, that includes primary series and booster series. In addition to case investigation, contact tracing, coordination, and planning of vaccine events, public health staff continued to provide technical assistance and safety planning for schools and businesses, and community health, education, and outreach. We continued to conduct outreach through social media in 2021. We increased the followers to the PHHS Facebook page from 440 to 760 at year end. We're reaching thousands of people each week with weekly updates on COVID-19 case counts, evidence-based public health education and information, and other timely program and service updates. Each month, staff provide presentations to the PHHS board and write an article and participate in a WTIP interview to again share information about program and services with the community. Our public health COVID response included the weekly hub updates, frequent WTIP interviews, media releases, and the Cook County Voices of Vaccination campaign. The PHHS Advisory Council and Cook County Local Mental Health Advisory Council were active in making policy, service, and funding recommendations and conducting outreach and fostering connection across service organizations in 2021. Both councils welcomed a number of new members last year. The PHHS Advisory Council remained engaged with Community Health Improvement Plan activities, and a subcommittee of that group reviewed applications from community nonprofits for public health grant funds in the amount of $137,700 for 220. The Cook County Local Mental Health Advisory Council adopted a mission and vision to guide our work as a council, and you'll hear more from these groups in their end-of-year reporting. Finally, reflecting and looking ahead to next year, COVID again dominated much of our work across the department. While the courthouse reopened to the public in June, and we had several weeks with no new cases in 2021, we ended the year with our public health team overwhelmed with new cases due to Omicron and holiday gatherings. We've witnessed and felt the impacts of illness, quarantine, and closures ripple throughout our department and the community, both with staff and the people we serve. Reflecting on year-end 2021 goals, our goal is to vaccinate 80% of residents. As of this date, 84.9% of the total population has received at least one dose. 88.8% of those eligible, so those 5 and older, have at least one dose, and 84.5% have completed the vaccine series. We continue to have the highest rate statewide. Within the broader department and community health assessment goals of expanding access to behavioral health services, one goal for 2021 was to complete the certification with Department of Human Services to provide daytime crisis response services. While we didn't achieve that certification in 2021, we did continue to advance that work in meaningful ways. Some examples include reconvening local partners on our multidisciplinary behavioral health crisis response team, which includes the hospital, Grand Portage Human Services, Cook County Sheriff's Office, Violence Prevention Center, and others to share information and updates. We connected staff across those entities with training on 72-hour holds and in shadowing the core response team in Duluth to see how they work with embedded social workers in their police department. Staff participated in the regional request for proposal review for the regional mental health resource line and assisted the new responder first call for help in compiling local resource information for Cook County. We're also continuing to develop the Daytime Crisis Response Service, expanding that now to a partnership with Cook County Sheriff's Office, North Shore Health, and the Human Development Center, with support of the county's American Rescue Plan dollars to pilot an embedded mental health worker to work across systems. Again, this is modeled after other models in the region and state. A key priority for early 2022 is to backfill our 4 vacant positions. Andrea Tofty is starting this week in her full-time role as a public health educator. Christine Ordemann's hire was approved on the consent agenda. She'll be joining us later this month as an eligibility specialist. But we have 2 vacant social work positions on our adult and home and community-based services team that have been open for months. These positions have been posted multiple times, offers have been made, staff have declined offers for a variety of reasons. Underlying all of this is the fact that lack of access to affordable housing and childcare remain huge concerns for our staff, workforce, and for our community. Our department's committed to continue to engage with others working on these issues within the community as they impact our staff and our mission. 2022 also marks the start of a new community health assessment and community health improvement planning cycle. We remain hopeful that direct response work will decline over the coming year and that staff will be able to shift focus to our recovery phase, looking at how priorities across the community have shifted and what else has emerged over the last 5 years, as we convene community partners to define our collective goals for health improvement for the next 5-year period. That is my report on 2021 in the PHHS department. Happy to take any questions or pull up slides that you'd like to see again.
Thank you, Alison. Holy smokes, that's, if we thought Grace's presentation had a lot, that trumps it there, I'd say. Questions from the board? Comments? Yeah, Commissioner Svaleson.
Yeah, just very comprehensive and certainly reflected what I felt that the staff had been facing and dealing with, and I certainly, appreciate all of the focus and all of the hard work. And certainly the turnover of people is it's reflected throughout the community and throughout the nation. And it's ours to deal with your focus on trying to get people in and struggling with the issues we're aware of, but still have to make improvements on housing and child care. So we recognize that, but clearly appropriate to put in as the focus, because it is what's hindering us in being able to move forward and fill these vital positions. So thank you for the comprehensive report.
Thank you, Commissioner Svaleson.
Thank you, Commissioner Svaleson. Any other comments or questions from the board? Administrator Yorkie.
Thank you for that report, Alison. I think it's pretty clear that this has been a really difficult year for PHHS. I think more than any other department, Public Health and Human Services is dealing with moving goalposts all the time. Really, I mean, and it's due to a number of factors. Obviously, the pandemic has continued to place enormous stress on the department. The instability of, well, I shouldn't say instability, but I mean, the loss of partnerships in the community, the withdrawal of service, social services by some of our partners has created a tremendous burden. The illnesses that we're experiencing, we've been short-staffed, the turnover. One thing that I think Alison and her team do really well is they have to pivot all the time. They have to readjust to what's happening. And that's not easy to do. It's really difficult. And I just want to say thank you, Alison, to you and your supervisors and really the whole staff for the work that you've been doing to serve this community. It makes such a huge difference. And, you know, I'm hopeful that 2022 will bring some relief in terms of more stability in staffing. Hopefully the pandemic finally starts to wind down a little bit. But I know it's a tough road ahead. And I just wanted to say thank you for the work that you're doing to keep all of these programs moving forward. They touch the lives of so many of our residents here in Cook County. And it's scary to think what this community would look like if we didn't have these supports in place for folks. Mm-hmm. So thank you for the great work that you're doing.
Yeah, I'd echo that for sure. I mean, the 20% number or the 19% number really caught my eye, and that's, yeah, talk about an impact and an department that has impact in our community. And I also want to thank you for your leadership in this past year. You always present and communicate very clearly, and you're very thoughtful in your leadership, very intentional, and just being both compassionate and flexible as well. It's just, we're very lucky to have you as our director, so thank you for your work.
Thank you, Commissioner Ross.
Well, that moves us on to said director's report.
I'm
Alison.
going to be very brief because you've already heard a lot from me this morning. As I shared in my report, continuing to recruit for the 2 vacant social work positions. Oops. The in-home support program position in particular has been vacant since October, so that is a significant impact on staff who are having to backfill and continue to support the program and the independent contract service providers that they oversee. So I want to recognize Martina Johnson for all she's doing to keep things together for the team and the in-home support program. As I've shared, we've had several rounds of interviews. We've made offers. Offers have been declined for various reasons. I think it's valuable for you all to know some of those being pay, relocation barriers, and some personal family reasons as well. We're thrilled to have Andrea Tofty coming on board. I want to say a little bit more about her work, that she will continue to provide the testing services in partnership with ISD 166. So she's piloted and really designed that program. She'll take that with her into her full-time role. We're bringing on Maggie Farchman at 5 hours a week to do some outreach and education support. And we're bringing Abby Banusa on board at 15 hours a week to train in on case investigation and contact tracing. Abby worked with us previously as an intern when she was in an undergrad in public health, and Maggie, of course, worked with us early on in the pandemic throughout 2020 and 2021, providing a variety of services. Christine Ordemann is joining the team later this month as our new eligibility specialist. And want to add as well that we had a really strong pool of applicants for that position. We were grateful to see so many people interested in that job, and a lot of people who expressed just wanting to be a part of what's happening at PHHS, which was nice to hear. Agency updates, the financial report that was approved under the consent agenda, just want to add a caveat that that's preliminary. We do continue to pay bills and receive revenues for several months into the new year. And lastly, just wanted to add, under items for board action is a request for a letter of support, or a motion of support rather, for the HRSA substance use disorder program. This is a reapplication. We're resubmitting to the Federal Health and Human Services Agency with a few minor updates to what was submitted last year. This is a collaborative project with Grand Portage, Sawtooth Mountain Clinic, area schools, and other partners in the areas of substance use prevention, treatment, and recovery services. Our primary role as a department would be to support the prevention side of things in partnering with youth and schools to increase engagement and other prevention activities. This is an ongoing goal of our public health team and was defined in our last 5-year health assessment. So I'm happy to take any questions on my report or the request in front of you for board action.
Questions from anybody? All right, then we have a request in front of us. And the HRSA, that's in addition to the item 8A, the resolution for
That
support?
is the resolution
Okay.
of support,
Yeah,
is
thank you.
for that HRSA grant.
Yep. Well, I would entertain a motion. Commissioner Sullivan?
Mr. Chair, I'd like to move to support Rural Communities Opioid Response Program grant application.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Svaleson supports.
Thank you, Commissioner Svaleson. A motion and support. Any further discussion? Hearing or seeing none. All in favor? Aye.
Aye.
Opposed? Same sign. Motion passes unanimously. Thank you, Board. And then we can move on to item 9 for committee reports. First one is the Active Living Steering Committee. Commissioner Svaleson.
And the committee did meet. That was our day of our organizational meeting, so I was not able to attend. But looking at the minutes from the meeting, they had good attendance and good review. Betsy Bloom put forward and basically pulled the group together to review the things that had been active and ongoing in the past, what was accomplished, what was still left to do. Good discussion to get the group aligned on what needed to be done going forward. And so I think I'm looking forward to the beginning of this next month so I can re-engage with the group and assist in any way I can to move these things forward. A lot of great activities that are coming up.
Great. Thank you, Commissioner Svaleson. Moving on to item B, AOA. One thing I'd just like to give a shout out to AOA is they had a Boots for Kids giveaway, and that was happening largely in the Virginia area, and AOA asked us to promote it, and Jim Boyd with the chamber said, well, I don't think anyone's going to be driving to Virginia for a pair of boots. So if there's a way we could get them here, that'd be great. And so he asked me to pass that request on, which I did, and they sent 95 pair of boots. The YMCA graciously accepted them to dole out, and I didn't see how many was left this morning. I was there, but last week I think there was like 12 pairs of the 95 left. So I'd say very strong success with that, and so very grateful for AOA's contribution in our community as well as with the continued distribution of food as well. And Bev also sits on the AOA board. I don't know if there's anything else you wanted to add just with your involvement.
And I want to thank you because I know you brought that up about bringing those boots up here, so thank you very much. and our transit drivers made that transition, brought them up to the Y. Last week, I believe Robin got, or 2 weeks ago, Robin brought them up to the Y, and then Pat went and picked up a batch and brought them up to Grand Portage this week, or that last week, late last week. So,
Excellent.
yep, and everybody was absolutely thrilled, so thank you very much for bringing that up. Sometimes,
Yep.
you know, AOA does a lot of programs, and, you know, Cook County sometimes gets left out, but they speak up and they're willing to do it.
Yeah, it was, yeah, and it wasn't my idea, I was just an in-between there, so, and, so I really appreciate everyone's keeping their feelers out there for opportunities, and yeah, the transit drivers are a huge part
Yep.
in making this happen, so a lot of thanks goes out to them as well, so, yeah, we'll keep looking for more opportunities for our community too. Let's see, Arrowhead Health Alliance, we have not met. I don't have anything to report. Item D is Arrowhead Regional Corrections, Commissioner Hawkins.
I don't have anything to report. We will be meeting on Friday. So.
Okay, thank you. Moving on to item E, Arrowhead Regional Development Council, Commissioner Storley.
Thank you. Nothing to update. We're meeting on Thursday with some updating perhaps on the senior linkage. So I'll give some more report on that in February.
Okay, thank you, Commissioner Storley. Moving on to item F, Community Health Board. Biggest news, I think, is we'll be confirming our newest member, Frank Seo, who has been serving on the Public Health and Human Services Advisory Council. So very, very grateful for his service there, and I think he'll be just a wonderful asset for the CHB, and very excited to have representation there. Item G, the Cook County Local Advisory Council for Children's and Adult Mental Health. Rana, do you want to give a report there?
Yes. Can you hear me?
Yes, thank you.
Okay. All right. We met last Tuesday, and we had a new community member join us, Lord Durenberger. We elected officers, and I'm continuing to be the chair, and James Zimmer is the vice chair. And we had the principal from Oshkosh School come and talk about their services and needs for mental health and help with the students, and they do quite a few things. They could use, I think, more help and services, but they're not, they're handling things pretty well. One issue is Carly Puck has been doing yoga at the schools, being paid by a grant which actually expired at the end of December. So we spent some time offering her ideas of how she could get continuing funding, because it's been a very, very successful program for the students in all the schools to reduce stress and feel good. And we had the principal from Birch Grove could not attend, but Alison gave a report on how they're doing, and they don't see any need for additional mental health services at this time. And we talked about quite a bit about mental health in the community and for students, and even specifically suicide prevention. That is always an issue, and it was a very supportive meeting for people who are working and people working together as a group to support each other when they need it. And I think that's about it. There's a Children's Summit February 16th. I don't know. I think those are the highlights. It was a very good and long meeting.
Thank you, Rana. And we'll move on to item H, the Cook County Restorative Justice Committee. Commissioner Hawkins.
Kind of the same thing. We haven't had our January meeting yet.
Okay, thank you. Item I, Council on Aging, Commissioner Sullivan.
Yes, as mentioned last month, the Cook County Council on Aging is struggling a bit financially, and they have done some reorganization with their staffing to accommodate their situation. And on Wednesday are going to be meeting to come up with some hopefully creative ways to address their financial challenges. And again, those financial challenges are primarily with an increased cost in the food that they are serving to our community, and also an increased need that they are seeing within our community. And then the next item, J, Emergency Preparedness Committee. We did not meet because we had a COVID emergency, and Grace could not be there to lead us in that discussion, so we will be meeting this week.
Thank you, Commissioner Sullivan. Item K is the Healthcare Planning Committee. Commissioner Storley.
Thank you. We did not meet, but I'll go on to NACO. So I've become aware from the Federal Health and Human Services, a grant program that's coming up. And it's going to be, they're going to be using part of the American Rescue Plan. They're going to actually be using $48 million in grant funding to public health workforce in rural and tribal communities. So I will get more information. The application process starts on Friday, March 18th. So we have some time, but I'll review this with the Director of Health, NACO, Blair, and see what else I can get out, especially for Jen to know about that in Grand Portage. So there'll be an update next month.
Very good.
Thank you. Northeast Minnesota Office of Job Training, that's me, and we did meet. Not a whole lot of updates, I think, for our county through them. Certainly seeing lots of challenges, much like we're hearing everywhere. This is one of the groups that gives me a better pulse of what's going on in the region, and it's always very interesting to hear the different perspectives of the different commissioners, whether it be labor pool or housing or short-term rentals or jobs or what have you, but. There is a plywood plant, a press board plant, I guess, opening up. I believe it's in Cohasset, and they gave a tax abatement for that, and that was something that caught my ear because we had been talking about tax abatements and had that policy, and of course, one of the reasons for their abatement is for the number of jobs that it would produce, and the number of trucks that would be needed to supply that plant. Well, turns out there's a workforce shortage, and also a commercial CDL driver shortage as well. So it was just one of those things that I found really interesting, the different perspectives on where things are at, and in the long run, I think it's going to be a very productive and powerful asset in our region. But in the short run, it's having significant challenges. So, but nothing directly applicable, I guess, to that group. North Shore Collaborative, nothing to report there. Although that was one of the avenues we thought the yoga program for youth could have potential. Most of all of the grants we give out for the North Shore Collaborative are focused on the youth and giving opportunities in the youth. And I've heard so much positive feedback about this yoga program that it seems like it could be a really good fit. But we'll see where the board lands on that, assuming an application comes in. Moving on to item O, Public Health Human Services Advisory Council. Roger is not here, but Pat, I don't know if you want to give any.
I certainly had a couple of things. Roger did a great job last year, and we, as everyone knows, in January had a reorganization meeting, and I was elected vice chair. Bev Green was elected chair, but because of a bylaw issue, I'll be taking the chair spot for the next couple of meetings. It was an exciting meeting. We are certainly as impressed with what the Public Health and Human Services team is doing as you are, and we're very close to it, and we really appreciate Alison and her team's willingness to listen to us and to ask us about what's going on in the community and to take steps to help whatever it is we bring up. So I've been on the board for 3 or 4 years now, and it's a really fulfilling spot. We had welcomed back 2 old new members. Jerry Lilja and Carla Lapointe have joined us again after being off for a year. We're excited that they're here because they've got some great institutional knowledge, but we're also looking for new members. And we're certainly looking for new members that represent the variety of community people that we have. So anyone out there who's really looking to join a board that makes a difference, I would say this is a great one. And the amount of time that is needed as a board member is minimal, but it's very impactful. So that was a really great meeting. We're looking forward to this next year, and also revisiting the community health assessment, because I think that's proven to be a very good program to institute change here. And while I've got the floor, I'm just going to mention I'm also part of the early childhood ECFE movement that's been in place for about the last 3 years. And I'd like to make you all and the community aware of a meeting that's going to happen on March 14th. We are going to have a town hall, and you'll get a lot more information about this, but it's going to be a part of the most recent grant we're working on with First Children's Finance. And First Children's Finance has worked these kinds of programs with other communities, and out of this town hall, I believe we will see some positive steps on making more child care slots available in this community. So we're going to need a lot of input from a lot of people that night, and you'll be hearing more about it. But I think I'm very heartened to hear everyone keep talking about the need for housing and child care, because they need to be joined at the hip. One will not be as successful without the other. So we continue to work really hard in that child care field as well. And I think that's all I have to add. Have I missed anything, Alison?
I'd just add that included in the board materials was our year in review report from the PHHS Advisory
Right.
Council to see more on our activities, reflection on goals, and looking ahead to the next year.
Right. That's it.
Well, thank you very much. Yeah, it is a very powerful advisory council, just as a sounding board or as feelers out in the community, communicating with staff and the department what's going on, what's needed, and if there's any gaps, that's almost like an early sight sort of thing. So thank you for stepping up here as well and giving the report. Well, item P for the good of the order. Anything anyone would like to add? I would like to send out condolences for Frank Moe. Commissioner Sullivan brought our attention to his condition worsening, and then he did end up passing. And so just a very sad situation, and our hearts go out. With that, we're on to item 10, which is adjournment. I'd entertain a motion to adjourn.
A motion to adjourn.
Is there support?
Support.
Motion and support. Any further discussion? All in favor?
Aye.
Opposed, same sign. Motion passes unanimously. Have a good day. Thank you, Rana.
14. 6 o'clock, or 6:30, one or the other. But I'll let you know, but there'll be much more coming out about it. Sorry.
Wake us up.
Yeah. Right.
Yeah.
Yeah, so it's going to be a really exciting time, I think. We really have to figure this out. 66,261 kids?
Yeah.
Unbelievable.
Yes.
And they'll be giving a report on all of the findings and all of that, and then we'll talk about what we could do, what the priorities are, and see if we can figure it out.
Bill Hansen called me a few weeks ago.
This is about the same thing.
Okay, so
Yes.
coordinate stuff with him too? and
Yeah, oh, he's on this committee.
He's going to come before the board?
I don't,
also?
yes, he's
Eventually.
talking about that,
Yeah,
yes.
Yeah,
I
because he
don't
has to
know
have a
when.
plan.
Yes.
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 So do I sign it?
Because I do think the county has to.
I was involved in ECFE when I first moved here for 3 years.
I know that.
Yes.
I think
Yes,
either is
ma'am.
fine.